Tonight, community spread of COVID-19 is confirmed after 5 new cases. An earlier curfew and a suspension of all liquor licenses form part of tougher protocols announced by Prime Minister Alan Chastanet.
We are going to extend the curfew, which was from 11 to 5 o'clock in the morning.
And the Medical and Dental Association calls for authorities to revise the 10 people per bus protocol, saying it is too risky. We have the details of these stories and more coming up.
This is the Hot 7 Nightly News with Lovelace and Amy Joseph.
Good night. It is Monday the 30th of March 2020. Welcome to the Hot 7 TV Nightly News. We're on Flow Channel 117. The broadcast is also being simulcast on Kiss FM and on our Caribbean Hot FM mobile app. I'm Lovely St. Amy Joseph. Thank you for joining us. St. Lucia has confirmed 5 new cases of COVID-19 and in-country transmission or community spread of the virus. Chief Medical Officer Dr. Sharon Belmar-George informed the nation of the newest confirmed cases in a televised update to the nation on Sunday. The race is now on to do the necessary contact tracing and ramp up testing for the virus. Members of the public are being urged to visit the nearest respiratory clinics as needed. A 24-year-old with a travel history to New York, a 45-year-old with a travel history to New York, a 47-year-old with a travel history to Barbados and Dominica, a 36-year-old with a travel history to Barbados, and a 75-year-old with no known travel history to countries affected by COVID-19. These are the island's 5 newest COVID-19 cases. It takes the island's total of confirmed cases so far to 9 and confirms what many, like Dr. King, said should be looked at as a fact, that St. Lucia has community spread of the virus.
Given that case 5 has no travel history or known contact with anyone with travel history, this confirmed case points to the existence of local transmission of COVID-19. Aggressive tracing of the contacts of these cases is currently underway by health teams dispatched to the communities of interest. The Ministry of Health has observed that all of these cases were captured through our community respiratory clinics. This highlights the usefulness and effectiveness of these clinics.
Dr. Belmar-George urged the public to use the 311 hotline and the respiratory clinics, noting that the national healthcare system has been adapted as part of COVID-19 protocol to allow for a more robust system able to respond to the virus.
New pathways to care have been created, and the public is asked to utilize these as required to access care. The 311 hotline is available to provide general information on COVID-19 and access points of care. As of Monday, March 30th, this service shall be available 7 days a week and shall function from 7 a.m. to midnight daily. Also, 40 cell phones have been dispatched to our medical clinical teams. These numbers will be shared later this evening for persons requiring clinical advice from a physician. Persons with flu-like symptoms can access care at their closest respiratory clinic. The 5 existing respiratory clinics are the Gros Islet Polyclinic, La Clery Wellness Centers, the Dennery Hospital, Viewfort Wellness Center, and the Soufrière Hospital.
Testing will also be ramped up, given that St. Lucia now has the capability to test for the virus. But there is a contingency plan in place for any anticipated challenges in doing local testing.
To date, a total of 139 COVID-19 tests have been conducted. 71 were conducted by the Caribbean Public Health Agency, and 62 were conducted in St. Lucia since commencement of testing this week. All tests for COVID-19 and related treatment and care are free of charge to individuals. St. Lucia, like other countries globally, we anticipate interruptions in regular shipment of testing supplies, and in periods where this shortfall in supplies may occur, arrangements have been put in place to utilize the Caribbean Public Health Agency for testing of samples when necessary.
The chief medical officer noted that the arrival of over 100 Cuban medical professionals on island will be central to the fight against COVID-19 and the flattening of the curve for new infections. The island's Prime Minister, Alan Chastanet, has indicated that he is not about to sit back as the COVID-19 crisis has hit a new level of seriousness. During an address to the nation, moments after it was revealed that the island had recorded 5 new cases of the virus, including in-country transmission, the Prime Minister changed the conditions of an already in-place partial shutdown, making it more stringent. He said it is for the own well-being of everyone on island that new measures are being put in place.
Prime Minister Alan Chastanet has taken a new, tougher approach to the ongoing battle against COVID-19 after he announced to the nation that new, tougher measures will be implemented upon citizens island-wide. The live announcement was made on Sunday afternoon, and the decision for the tougher approach was born as a direct result of the discovery of 5 new COVID-19 cases on island, including 1 case of a 74-year-old national with no recent travel history, indicating the first recorded case of in-community transmission. The PM said from inception, the government's main aim was to keep the virus at bay. However, the defiant behavior of locals who refused to adhere to the quarantine protocols proved that there was need for stricter action to be taken by his administration. He went on to give the new details.
We are going to extend the curfew, which was from 11 to 5 o'clock in the morning, 11 o'clock at night to 5 o'clock in the morning. And as of tomorrow, it will be from 8 o'clock at the night until 5 o'clock in the morning. Secondly, that we're going to extend the period of quarantine, which was due to end around April 5th. We're now going to extend it to April 14th. And the third part to this is that we're going to suspend all liquor licenses in the country. And so anyone who is going to be operating a bar or a restaurant other than a drive-through or takeout will be in breach of the law.
The PM lamented the behavior of the masses, which he said played a major role in his decision.
I don't think that any of us would be surprised when I say to you that we have not done a good job of making sure that we're all doing the right things. I mean, the government has made the resources, has put all of the laws in place, has increased the number of policemen out in the field, but many of us have just refused to adhere. There's still examples of people going to bars. There's still examples of people going in crowds to the beaches. There are many operations that have continued to operate, flaunting what was required by the government.
Prime Minister Chastanet, who was accompanied by Acting Commissioner of Police Milton Daisy, as well as the island's Chief Medical Officer Dr. Sharon Belmar George, said the new rules are for the greater good of all in the nation.
With me is the Commissioner of Police, and he'll be speaking shortly, but I've asked him to strengthen his staff and also their level of tolerance. And again, I'm appealing to St. Lucians one more time. This is for you. This is for all of us. This is for the elderly, people in this country who have diabetes, people who have respiratory problems already, people who have hypertension. And we've seen now at the results in Italy, New York, and throughout the States that Corona does not discriminate. There are as many young people dying from this as there are elderly people. And we can't continue to believe that we're immune from what Corona offers us. And some of us are, but there are many of us who are not. And the only way that we're going to defeat Corona for now is by self-quarantining and by practicing social distancing.
The PM said it is not his intention to keep persons locked away indoors. Staying at home, he said, however, is the main way of ensuring that the virus is kept under control with as least casualties as possible. Reporting for Hot 7 News, I'm Rochelle Gonzalez.
The adjusted national curfew is now from 8 p.m. to 5 a.m. Police have put the public on notice that there will be no warning or coercing people to abide by the protocols. The full extent of the law will be brought to bear on those who insist on violating. Acting Commissioner of Police Milton Daisy says people will be arrested on sight. Acting Commissioner of Police Milton Daisy says at this stage police do not have the manpower or resources to be playing cat and mouse games with the public to get them to abide by curfew and social distancing protocols. Daisy has put the public on notice that anyone found breaking the 8 p.m. curfew will be arrested on site and held in custody for at least 72 hours and may face a fine.
We will not be running around. We do not have officers for that, running around asking persons to desist from doing this. You are aware. Police have warned you, and the coming week is not a time for warning. And I'm serious about it. Persons will be arrested. The Prime Minister has assured me that the fines would be put in place as of tomorrow.
People breaking curfew and vessels coming into the country illegally continue to pose a problem for police. Arrests and detainments have taken place.
On Friday, that is past Friday at 2 a.m., 2 persons were arrested in Grozile for failing to comply with the curfew. They had been charged and were granted bail. However, I could assure you that in the coming days, it would not be so easy. I must also report that one vessel, a boat, had been seized by the Marine Police. I commend them for such action, and that boat is impounded with them.
Daisy says space has been made to accommodate the mischief makers and lawbreakers.
The custody suite that is at Central Police Station is available. I have ordered that it be empty so that persons who were arrested and were in there have been taken to Babono, Masha, and Grozile Police Station just to make that space that is available for persons who fail to comply.
The acting COP says the men and women of the force are putting their lives at risk to serve and protect the public, and it is not a matter that should be taken lightly. He urges members of the public to also take a level of personal responsibility for their safety by simply staying home. The president of the St. Lucia Medical and Dental Association, Dr. Merle Clark, is calling for the 10 people to a bus protocol to be reviewed as it poses a major health risk. She says while she fully supports the new stringent measures by Prime Minister Alan Chastanet, he needs to go even further to ensure that the virus is contained now that there is community spread. An earlier curfew, an extension of the partial business shutdown, a suspension of all liquor licenses, all commendable moves by the government, according to the president of the St. Lucia Medical and Dental Association, Dr. Merle Clark. But she says even tougher decisions need to be made, especially with the public transportation sector, to win the fight to contain COVID-19.
We believe unequivocally that 10 people on a bus is way too many. It does not allow for distancing. There is too much contact. We now have evidence of community spread, and that is a game changer. We absolutely have to have fewer people on the buses.
The SLMDA president is concerned that if swift action is not taken to reduce the numbers seen congregating outside supermarkets, St. Lucia could risk losing ground in the fight to contain the virus.
We do believe that lessening access perhaps to public transportation will reduce the numbers that we're still seeing outside the stores. A stop needs to be put to that. If we do not, what we're going to have is an unmitigated disaster on our hands, and we still have the opportunity. We've done well so far. We still have the opportunity to stop COVID-19 in its tracks.
Dr. Clark says the association is aware that there are members of the essential services who need to be accommodated.
Our police officers, fire officers, nurses in particular, do have to be able to get to work to serve our people. So measures must be put in place so they can be transported to work. And we do believe that a system has to be put in place for that. The elderly are at home, the sick, the shut-in, people who may need to be able to get to hospital, we have to be able to cater to them.
The St. Lucia Medical and Dental Association says so far the crisis is being managed fairly well, but the country cannot afford to become complacent. This is the Hot 7 TV Nightly News. Still to come, a man is taken into quarantine after making a visit to a female companion at a quarantine facility. The leader of the opposition speaks out on the need for a stimulus package in a national address. And no lining in the cabaret. But what about the alcoholics who will go through withdrawals? That and more coming up after the break.